Hello, I'm Dr. Ken Landau. Thanks for watching. Let's talk about Diflucan or Fluconazole. This is an oral medicine typically used for yeast infections, vaginal yeast infections, also referred to more properly as vulvovaginal yeast infections. The drug was patented in 1981. The FDA gave it marketing approval in 1988. It's on the World Health Organization list of essential medicines, and it's part of the azole family. It comes as a tablet, 50 milligrams, 100 milligrams, 150 milligrams, 200 milligrams, and as a powder for suspension and intravenous administration. But most people who take the drug are going to take it for vaginal yeast infections, or women can take it to prevent vaginal yeast infections if they're going to begin a course of oral antibiotics. It also can be used as a treatment for people who develop yeast infection in the mouth or the back of the throat, or even in the esophagus. And sometimes people develop yeast infection in the urinary tract or even in the lungs. The intravenous form is used for a type of meningitis caused by another fungus known as cryptococcal meningitis. And if the people develop this condition and it's not due to HIV infection, AIDS, then the drug can be used. It also is used in bone marrow transplant patients or solid organ transplants in order to prevent yeast infection, also in people who have very low white blood count due to typically chemotherapy, or in babies who are of very low birth weight. Sometimes it's used off-label for a skin infection known as tinea versicolor, also thought to be due to a yeast infection, but it's not very potent for the typical athlete's foot. Diflucan was the first antifungal that was developed for relatively minor infections like the yeast, available orally, or more serious infections like this cryptococcal meningitis, and then used intravenously. Prior to that time, we only had two major antifungals. One was known as amphotericin that needed to be given intravenously, had lots of side effects. The other one, known as flucytosine, unfortunately it had a limited range and everything seemed to become resistant to it. Well, this drug, a new class, closest thing to it would be ketoconazole, but when this drug, the Diflucan, came around, it had an improved safety profile, it had more predictable absorption, and the intravenous dose and the oral dose seemed to do exactly the same thing. Now, the package insert for the medicine suggests that a culture should be taken prior to the institution of therapy, but since most therapy is for vaginal yeast infection, that typically is not done. Now, sometimes there's resistance. Resistance oftentimes in those people who are suffering from advanced HIV, advanced AIDS, when they're treated for either oral or esophageal candidiasis. But we know that there can be some mutations in the gene of the yeast that makes it especially resistant. So there's a gene known as ERG11 that codes for a very essential enzyme that's necessary for the formation of the cell wall. Well, if that gene is mutated, then the drug won't work. Also, there's another kind of a mutation that causes the medicine to be kicked out of the cell much more quickly than normal. Well, most people think that yeast infection is all alike, but that's not true. Candida albicans is no question the most common kind of yeast, but we also have Candida krusei and Candida glabrata. And unfortunately, those yeasts tend not to be susceptible to the ketoconazole. Now, the typical dose for a vaginal yeast infection is one dose, one time, 150 milligrams. Unfortunately, there's a relatively high concentration in the vaginal tissue and only a slightly lower concentration in the vaginal fluid. Now, with ongoing antibiotic therapy, if a woman's going to receive that, well, maybe she needs to have a repeat dose every 3 to 4 days while she's taking the antibiotic. And some women, unfortunately, develop a condition that we call recurrent vulvovaginal candidiasis, where they typically are going to develop multiple recurrences over the course of a year. And for those women, it seems that it's probably most appropriate to take one pill once a week. Now, the cure rate in the average woman with vulvovaginal candidiasis is going to be about 55% at 1 month. That means a clinical cure, there's no evidence of infection, the culture is negative, the microscopic examination is negative. And that sounds good. Well, women have two choices. If you have a vaginal yeast infection, vulvovaginal yeast infection, you could take the oral medicine, this Diflucan, or you could use an intravaginal azole. That would be like Miconazole or clotrimazole, many other similar products available without prescription at the grocery store or drugstore. It has to be taken either for 1 day up to about a week to 10 days. Now, most women find the oral therapy much more acceptable, but the intravaginal therapy is much more available. The drugstore is open pretty much any time you need to go over and get it, instead of going through your doctor. Well, about 75% of women who have a vaginal infection, vaginal yeast infection, going to have fewer than 4 episodes per year. And in those women, the 150 milligram dose is very good. The 1 month follow-up shows about an 80% cure, about a 70% culture negativity, so we can't find the yeast anymore, and a combination of both in about 60%. Well, unfortunately, about a quarter of the women develop recurrent vulvovaginal yeast infections. And that means more than 4 episodes per year. Now, the cure rate, the clinical cure rate, is going to fall down to a little less than 60%. The culture negativity going to fall down to less than 50%, and a combination of both is going to be present only in about 40%. The dose, if a person has oral candidiasis, start off 200 milligram the first day, then cut down to 100 milligram a day every day for at least 2 weeks after the symptoms go away. The symptoms tend to go away after several days. If a person has esophageal candidiasis, a little bit higher dose might be necessary, still the 200 milligrams the first day, but then a person might need up to 400 milligrams a day. Minimum treatment is for about 3 weeks. Pregnancy, well, it used to be thought that the drug was probably innocuous in pregnancy, especially if you're only going to take 1 pill. It was thought that if you took a higher dose, well, it was acceptable if you had a life-threatening infection, but it was associated with an increased incidence of miscarriages and sometimes with heart defects. Unfortunately, we've just learned relatively recently from the Quebec pregnancy cohort study published in the Canadian Medical Association Journal just in February of 2019, study where they looked back at more than 400,000 women's medical records, and they found that even a dose of 150 milligrams led to an increased risk of miscarriage and other problems. So probably not a good idea to use this medicine in pregnancy at any time. Breastfeeding, well, it's found in the milk, so it's not recommended. In the elderly, if there's a decrease in renal function, might be a problem. Typically not associated with significant number of complications, especially if you take just 1 pill. But some women are going to develop nausea, vomiting, diarrhea, maybe a rash or a headache or some dizziness or abdominal pain, but not much more. Very, very rarely problem with the urine or low potassium or some seizures or numbness and tingling, but that's in long-term dose. Some women have potential for cardiac abnormalities. These women have what we know as a long QT interval on the electrocardiogram. Got to be careful giving the medicine for long-term to those women. If there's a hypersensitivity to the other azoles, like ketoconazole, then there's probably going to be a problem with this one. Have to be cautious if a person is taking quinidine. The SSRIs, drugs like Prozac, erythromycin, or clarithromycin, have to be cautious if a person is taking the oral hypoglycemics for diabetes, taking medicine like Coumadin, thin the blood, an anti-epileptic drug like phenytoin or Dilantin, taking an antidepressant in the TCA family, the old-fashioned tricyclic antidepressants. And it also might block the activation of losartan. Losartan is very commonly used anti-high blood pressure medicine. Well, the way the medicine works is it works on that enzyme. It prevents the enzyme that's necessary for the cell membrane. And it just so happens that the enzyme is much more susceptible in the yeast than it is in the human. Now, the drug can be taken with or without food. There's almost complete absorption within just a period of about 2 hours. Bioavailability isn't changed with stomach acid. The medicine has a 10-fold concentration in the urine or the tears or the skin versus in the blood. It's about the same concentration in the blood as it is in the saliva or the sputum or the vaginal fluid. And the concentration in the central nervous system is about 80% of what it is in the serum. So all of that is good, and especially since the half-life of the drug is anywhere between about 20 and 50 hours, means all you have to do is take it once a day, and it's going to be excreted in the urine, principally in the urine. So if people have a problem with their kidneys or their kidney function, then that means that the drug might have to be reduced in dose. The drug works much better than nystatin, which was one of the old standbys. And the good news is that since it's now off patent, the drug price is very reasonable. You can get a tablet, a single tablet, with a coupon from GoodRx anywhere between $3 and $9, as opposed to, say, about $70 for one single pill if you happen to go and pay cash for the name brand drug. So if you have vaginal yeast infection, which is more properly called vulvovaginal yeast infection, fluconazole may well be the way to go, especially if you're suffering from recurrent episodes. And for those people who have recurrent episodes, then it might be appropriate to take the drug weekly. Is it any better than the intravaginal yeast infection medicines if you have a single case or an occasional episode? No, it's just a heck of a lot more convenient. Anyway, thanks for watching. I'm Dr. Ken Landau.